Once again, it's Your Health Matters every Wednesday evening, 8 p.m., 1 hour. Some person may be doing a lot of other things. I just put tent tonight on tour tent. Upstairs tent, sorry. I go in there after. You know what I mean? Come on. But your health matters. And remember, you can give us a call, 457-9997 or WhatsApp, same 457-9997. And we will certainly be able to entertain any question you have on the topic of the day or any other thing that is concerning you, worrying you, bothering you, or you just really wanted to clarify. I want to really talk to you one more time about a subject called heart disease, cardiovascular disease. Well, what is it? Well, the truth is that it's a lot of different things put together. Heart disease isn't just one type of thing. But there's some important information you got to know first of all. Cardiovascular disease, what we call CVD, cardiovascular disease, is the leading cause of death globally, in the whole world, globally. And 17.9, almost 18 million persons die each year from cardiovascular disease. Leaving out the time of the pandemic, I'm talking about 18 million people die each year. So 2019, 18 million. 2023, 18 million. 2024, 18 million. Next year, maybe a little bit more because it's been rising. It was dropping for a period of time. Cardiovascular disease was dropping, 2011, 2012, 2013. Now it's been rising again. So next year, expect there to be over 18 million people who die. Consider that, 18 million people die each year. Now, when 18 million people die of cardiovascular disease, that is 1/3 of the total deaths globally. Each year, what if you would believe this, that close to 50 million people die each year. And 1/3 of them is from cardiovascular disease. 32%, let's say 33%, 1/3. And guess what? Of those that die from cardiovascular disease, two of the cardiovascular diseases, two of them represent some 85% of cardiovascular disease deaths. What are these two? Kamal, listen to this. Heart attacks and stroke. Heart attacks and stroke. Simple. So a heart attack and a stroke represents 85% of the cardiovascular deaths, which are 1/3 of the total deaths around the globe. Now, guess what? Over 3/4 of the cardiovascular deaths that take place are in either low or middle income countries. You may think that's strange. You may think that, cardiovascular death is really occurring in America, Canada, England. It's happening all over the world, and the majority of them are happening in low-income countries. And we'll come to that mainly because of the resources of the healthcare and the prevention and all that kind of thing. It's not that in poorer countries people don't eat a little better and they don't eat all these high cholesterol foods, but when they do get heart disease, how can you stop it? How can you cure it? How can you treat it? How can you do the stuff to get rid of it? Now, most cardiovascular diseases can be prevented. That's the important thing. They can be prevented by addressing certain behaviors that people have been taking place. At the top of the behavior is smoking cigarettes, tobacco, then unhealthy diets, and then obesity that goes with unhealthy diets, then physical inactivity, not physical activity, physical inactivity. And then the last and fifth one is harmful alcohol use. We come up to carnival time, and half the songs are going to be about rum, or this year I heard they're already talking about rum. I thought a lot of the songs were from about LGBTQ kind of stuff, and so, you know what I mean? rum. And harmful use of alcohol. Boy, that is big. You know, how does alcohol go affect my stomach? And alcohol may make me a little giddy and dizzy. And so, how got alcohol affect my heart? Well, boy, it's one of the big risk factors behind tobacco. Now, it's important to detect cardiovascular disease as early as possible, so that you and your doctor can manage the cardiovascular disease and prevent it from leading to early, what we call premature death before the age of 70. So you hear that point. Premature death, you know, as I said, we are promised to some extent 70. Age of 70. Am I correct with that? Huh? And when somebody dies at 60, that's a premature death of 10 years. Somebody dies at 50, you know? And guess what? A lot of people are passing away from premature death because of cardiovascular disease. Now, what are the cardiovascular diseases? I started there, but let's go into them. Now, cardiovascular disease are a group of disorders of the heart and blood vessels. Blood vessels and the heart. And you've heard of coronary artery disease. This is a disease where there are blood vessels that supply your heart. Blood vessels supply your heart. When they get blocked up, you get coronary artery disease. That's not nice. Then there is cerebrovascular disease. I don't like that term, but we're talking about cerebral means the brain, going up to the brain. And we have blood vessels going up either side of our neck. I could feel mine right here. Yeah, it's nice. Oh, it's a nice beat. I can feel it. You know, oh, yes, it's good. Come on, I'm all right. I could feel it. Yes, it's pumping nice and simple. Well, guess what? Those blood vessels, we call them the carotid blood vessels, they could get blocked too, just like a coronary artery disease. Matter of fact, I'm sure I have a bit of blockage of them. I have a family history of some blockages that tend to take place in them. But I want you to consider, just like your drain pipe. Have you ever seen inside a drain pipe with all that grease and dregs that go down? Some of it ain't passing, sticking in, making your drain pipe narrower. You know? Well, boy, your cerebral, your coronary arteries going to your heart, and your carotid arteries going up to your brain, which is called cerebrovascular disease. Cerebrovascular disease. I'm sorry to use these technical terms, but cerebrovascular disease, blockage of the blood vessels going up, carrying blood to supply your brain and the structures in your head, right? Then, if you have your coronary arteries and your brain, blood vessels, I want you to know that there are blood vessels to supply your hands and blood vessels to supply your legs. Well, you can have peripheral vascular disease, right? Peripheral vascular disease, PAD, P-A-D, peripheral arterial disease, we call it. This is where the blood vessels going down into your legs, they too could start getting clogged and blocked. Sometimes you walk up Mackey's Hill or walk up Monkey's Hill, and it ain't that you get short of breath, Your legs start to give you pain and cramp because the blood can't get down into your legs to supply your legs, your toes, your calves, and so forth. Nah, that's peripheral vascular disease. Then there's another disease called rheumatic heart disease. Come on, you heard that before? Yeah. Rheumatic heart disease used to be very time ago, before antibiotics were developed and invented. What causes rheumatic heart disease? First of all, it's people who had a disease called rheumatic fever. And it's caused by a germ called strep. We've all heard of that, strep. Have you heard of getting a strep throat? People get a strep throat, and your body will fight it off fine. For some people, the strep can get into the back of your throat, through your tonsils, and try get into your blood. It will just give you a sore throat. It will give you more than that. And your body tries to fight it. But guess what? Your body develops some antibodies, some bad antibodies, that instead of fighting the strep alone, it recognizes other parts of your body as being funny. It ain't sure if that's a strep too. So start to attack your joints. It start to attack your kidney. It start to attack your fingers. And it could start to attack the valves of your heart and your heart in general. Imagine that. Your immune system trying to fight off. I didn't want to go back to COVID, but there's some similarities. Rheumatic fever was so common around the world. Guess what? Today, in Europe, England, Canada, America, they don't see rheumatic fever hardly anymore. But we still see rheumatic fever in other parts of the world, in low-developed countries that don't have the money to buy antibiotics, or they have antibiotics in the cities, but in the villages hundreds of miles away, in a mountain or in a valley somewhere, they ain't got no antibiotics out there. And strep disease. Now, there's another set of conditions. Do you know that people could be born with heart disease, congenital heart disease? You'll be born with a hole in your heart. You could be born with, all these things are small. The big ones are coronary artery disease and cerebrovascular disease. The blood vessels supply your heart, blood vessels supply your brain, and are blocked. But there's one I want to tell you about. It's called deep vein thrombosis. We were talking about the arteries just now. Do you know veins could also get blocked, especially in your calves? People who go on long flights and they moving about the place. You go on a long flight to England or a long flight to Los Angeles. You go to Miami and then you go to Los Angeles and then over to Taiwan. You gotta get up on the plane and walk around. If you don't, the blood vessels in your veins could start to clog. And then some people, they don't take care of their toes. There can be fungus in their toes. And the fungus in between the web of your toes, right? Fungus in your fingernails and fungus in the web of your toes. And what that does, it also allows germs to get in. And that could help cause clotting in the veins. All these things, you know. So all these things are important. So these are the cardiovascular diseases. But what I want to emphasize is that blockage of the veins happens small. Congenital birth defect, hole in the heart among kids is also, happens, but small. Rheumatic heart disease used to be big long ago, ain't so big now. And then peripheral vascular disease, that occurs. But 85%, almost 90% of heart disease is once again blockage of the blood vessels going to the heart and blockage of the blood vessels going to the brain. That's big enough. That's enough for me, you know? Now, heart attacks and strokes, as I've been talking about, are usually sudden events. And are mainly caused by blockage of the heart. Now, in the brain, you could get blockage of the blood vessels to the brain, but you could also have a couple of other things. Do you know the blood vessels in the brain could bust? I'm going to use that term. They could break and cause a bleed. But most of the time, strokes are going to be caused by a blockage of the blood vessels going to the brain rather than a bleed. But I find here in St. Vincent, a lot of people tend to have bleeds. But when a bleed occurs, that's not a good diagnosis, especially when a lot of blood leak out. When a lot of blood leak out inside the brain, it's not nice. It's not a lot of coming back, if I could say it that way. But when a blockage takes place in the vein, there are things that we might be able to do. In fact, you know what? If we pick it up early enough, the doctors could cut the skin hair, get the blood vessel, open it out, scrape out the plaque that's there. Do it very carefully, and they can then sew it back up, and you now have a clean blood vessel, Maybe another time they'll do the other side, but they'll check out first of all to see which side is, sometimes both sides blocked. Most of the time, both sides blocked, but one may be blocked more than the other. So do that one first, and then hopefully blood is still flowing through the other side. Boy, them doctors good to do them kind of surgery. But boy, you prefer to have a blocked coronary blood vessel than a bleeding blood vessel going up to the brain. Now, I've been talking, what are the risk factors? Why do people have heart disease, cardiovascular disease? Well, I mentioned it already. It's mainly because of behavior. Some people, as I said, you could be born with a hole in the heart, but it's behavior. Behavior. And again, at the top of these things is tobacco, an unhealthy diet, physical inactivity, and harmful use of alcohol. So that stopping tobacco use. Simple, look at this. Stopping tobacco use. Stop smoking. Reducing the salt in your diet. right? And the sugar. And eating more fruits and vegetables, certain type of fruits and vegetables. And just regular physical activity. Enough. We ain't talking about physical activity once every 3 months. And we ain't talking about physical activity every morning. No. We talking about 2 times a week for about, or 3 times a week for about 30 minutes. Do you know what? That goes a long way. And of course, stopping the tobacco, reducing the alcohol significantly. You hear what we're saying? We're saying to avoid harmful use of alcohol. Doesn't mean you can't have a beer. Doesn't mean you can't have a glass of wine. Doesn't mean you can't even have a glass of whiskey. But the harmful alcohol use in terms of rum every morning, that doesn't happen. People don't drink rum in the morning, do they? People don't stay in the rum shop until the rum shop close at night. Yeah, they don't do that kind of thing, do they? Well, I tell you, maybe that is harmful alcohol use. You know, we'll get into that some other time. So, the big ones, what are the symptoms of a heart attack and stroke? Let's go through that, because you got to know. Do you know that many persons who get a stroke or get a heart attack don't have any symptoms? They have a silent heart attack. They have a silent stroke. You hear that, Kemal? A lot of people have a silent heart attack and a silent stroke. They go to the doctor and say, Doctor, I haven't been feeling so well, and I haven't really been having this. I just ain't feeling myself. I just find tired. And so the doctor examine you, do some tests, do a cardiogram on you and say, you know what? We did an electrical test on your heart, right? We wire you up and check your heart. Your heart ain't nice. Or we do an x-ray and we find that, boy, your heart, the size of your heart is no longer like a Julie mango. It's now like a coconut. It's not like a Julie mango. It's now like a coconut or big sour sap. I've got to say it in this way. Yes, sir? I've got to put it over to you in this way. You know? Now, so that many people don't have any symptoms, but a heart attack or stroke may be the first sign of some underlying problems. How some people pick up, they have a heart attack, they rush to the emergency room and so. But a heart attack is usually pain and discomfort in the center of the chest. That's it. I'll talk about this maybe next week a little more. Pain in the center of the chest. And this pain isn't a sharp pain like a knife. It's like a pressure. It's like somebody sitting on the chest, you know? It's like a weight on your chest. But guess what? It usually comes and goes. It isn't like a pain that's there all the time. No, it comes and goes. Comes for a few 30 seconds or so. And it's not a pain that you move your arm and it gets worse. It's not pain where you breathe in and those things are because your ribs, you will lift up something and that sort of thing, you know? That's the reason. If when you move your arm, you don't get any inducement of the pain if you move your hip. For heart attack pains, the pain is just there like a pressure. And sometimes the pain starts to move. Pain could move over to your shoulder. Sometimes it can move to your back. Sometimes it moves up to your jaw. Feel a pain there at the same time. Sometimes it moves down your arm to your fingers. Sometimes when you have it, your fingers feel tingly when the pain. And sometimes when you have it, you go into a cold sweat. I'm not talking about hot sweat. I'm not talking about a hot sweat on a hot day. I'm talking about a cold sweat. You feel cold and so on. And some people even get a little nauseous during the time they're having the pain. You got to know these symptoms because this is like a warning. This is like a warning. And it's telling you the blood get into your heart muscle and your heart muscle crying out. Your heart muscle bawling a little bit. And most people don't tend to know that that is what's taking place. They ignore the pain. Some people, when they have this pain, they also get short of breath. So imagine that. Pain that's going down your arms, giving you a tingly feeling in your fingers. Pain that sometimes going to your back. It's coming and going. It isn't like a sharp pain, a knife or anything. It's like somebody just sit on your chest, a weight, and you get feeling nausea. You're getting cold sweat. Your arms sweaty, and you could be short of breath. You can't catch your breath, and it goes away. And you decide you ain't doing nothing about that. You thinking somebody do you, and therefore it'll go away. That's a time to take heed. You know what I mean? Now, I'm going to tell you a little bit about a stroke now and come back. I'll take a break. Let's talk about the stroke first. Now, with a stroke, on the other hand, it could occur quickly again. All of a sudden, you're feeling a little weak. You're holding a cup, and you can't hold a cup. The cup dropping out of your hand. What's going on? Or you feel like a numbness in your face or your arm, right? Or even your leg, you're having difficulty walking. Or somebody might notice you're a little confused, just for a little bit confused. But ain't that the confusion is for 2-3 seconds. The confusion's going on for a little while. You might have difficulty speaking. Somebody hearing you, you think you're speaking okay, hello, but you're saying something, whoa, 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 whoa. You're giving slurred speech. People can't understand what you're saying, It could also affect your eye. You could start having double vision because a stroke could be on one side of your brain and therefore it could be affecting your eye on one side, but the other eye could see. But boy, you're not able to make things out properly. And I said difficult walking, dizziness. You could even lose your balance. You could fall down, right? And some people have a headache. That's not a good sign. Especially if you have a sharp headache, that could mean sometimes there's a slow bleed. Imagine a drip of blood coming out of the blood vessel. It's beginning to bleed. I ain't talking about where like a water pipe break and water had to splash all over the place. That could happen in your brain too. A blood vessel could blow, but sometimes the blood vessel just start to leak, drip. But the brain is in the skull, and there's not a lot of space there. So a couple of drops of blood keep on leaking. There's nowhere for the blood to go. That's going to cause pain. It's going to cause confusion. It's going to... Long and short of it, most people, when it happens, they faint. They usually faint. They faint. Oh, some of them, when they faint, they go unconscious. They become unconscious. When we come back, we're going to talk a little about this.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. Of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Hello. what I've just described is two scenarios of the two most common cardiovascular disease, heart attack and stroke. I haven't gone into some of the other stuff, but guess what? Why I've told you this is not only for yourself, but in addition, you may have a grandparent living with you. You may have your mother and father or an uncle who used to travel, go sailing, down in Trinidad, he's come back home, he's living with you. He may have had some very strange lifestyle where he may have not had a healthy diet, whole ton of salt. He may have high blood pressure. He may also drink. He may have a bottle underneath his bed. You know what I mean? Drinking you don't even know. But the point, and I'm talking about unhealthy use of alcohol. But guess what? It's good that when you see these kind of symptoms of a heart attack or stroke, whether it is yourself or it is a relative or a friend, a stitch in time can save 9. And this is one of the reasons why I mentioned to you earlier that cardiovascular disease in poorer countries, underdeveloped countries, or lower developed countries, and middle income countries seem to be much worse than in other countries. I'll tell you, in America, man, they're eating a whole set of meat, red meat. You know, we don't do that. You know what I mean? They're having supersized sodas. They're having, you know, drinks that are extra large, triple large, and so forth. They live in very unhealthy lifestyles. High fructose corn syrup, all them kind of things inside there. But one thing they have going for them is that they tend to have insurance, many of them, or this Obamacare or what. And there is going to be a good hospital within 10 to 50 miles away from them. A good hospital 10 to 50 miles away from them. You can have a hospital a mile away from you, but if that hospital doesn't have all the things that can pull you back, you know, that can pull you back from the brink of death, then the hospital is not going to be able to save your life, even if it's close, you know? So you want something close, because if something's too far away, you have to drive, or someone has to carry you. During that time they're carrying you, it might be too late. Usually, it's important to get to a hospital with a heart attack or stroke within 10 minutes. If you get there in 10 minutes, if you get there in half an hour, just as good. If it take you have to ride a donkey to get there. You understand? Or if you have to catch something else or so, or walk, or somebody carrying a stretcher, you ain't getting there. Now, at least 3/4 of the world's death from cardiovascular disease occur in low and middle income countries. People living in low and middle income countries often do not have the benefit of a regular doctor to see them and check them out every month, every 2 months, you know, and to pick up early a detection. Because in some countries like America, when you go to a doctor, if you go to the doctor and the doctor just song you, check you and say, you're all right, the doctor's supposed to do an annual exam, do a cardiogram, take some blood, set it off, check for your sugar, check for your cholesterol, and not just your total cholesterol, check for your good cholesterol, your bad cholesterol. You know what I mean? Might even check your kidneys to see if your kidneys are right. You know what I mean? Do that. It's not necessarily necessary, but do that. And then maybe song your heart. Song it in the back, song it in the front. Listen to the heart. You want to see if the heart beat is regular. Nice to be nice, a nice rhythm. Come on, a drum rhythm. You know what I mean? Nice, keep that beat. Go ahead and so forth. But if it is all over the place, if it's doing a bit of soca, and then it start to do a reggae beat, and then it goes a salsa, and then come back and do a soca again. You know what I mean? That's not how the heart's supposed to function. You know what I mean? As a regular beat. So a lot of people in low-income countries, not only do they not see a regular doctor regularly, when it comes to an emergency, they're not 10 minutes away or 30 minutes away from a good hospital. I'll tell you something. That's one of the reasons why I'm so happy that this year they're going to start that acute referral hospital at the top of the runway. I know some people who walk in every day say, man, leave the runway for us so we could walk up and down. You still have some space to walk up and down. I want that hospital. I mean, I want a hospital because when I get my heart attack, I want to be at least 10 minutes away from getting there. When I get my heart attack, folks, it might sound very strange, at whatever age it's going to be. When I get my heart attack, I want to be able, that ambulance to come, or whoever is able to get me there and say, boy, I get there in time, because there are some things that can be done, First of all, if I know I have heart disease, cardiovascular disease, there's some people who will benefit from taking a baby aspirin. That helps to thin the blood a little bit and prevent the clotting from taking place inside those coronary artery blood vessels and inside those blood vessels going up to the brain. That's good. There are the tablets that if my heart is doing a soca beat instead of a reggae beat, you know what I mean? I can take those medications to bring it back to being a bit of a regular beat. You know what I'm saying?
Yeah, Doc, I think you should just stress the point that it's just one baby aspirin, because in a dire situation like that, you might be tempted to take the entire bottle.
Right. Yes. Well, I probably have to talk about this next week when I talk about the baby aspirin. I will talk about this because I'm not talking about someone who's 20 years old, 25, 30 years old. There are certain situations where we would recommend that you start taking a baby aspirin if there's a family history or if we've diagnosed you with that. Now, at the same time, we found that persons who are also very elderly, over the age of 75 or 80, it may not be necessary for them to take a baby aspirin. But I'll come back and clarify that. And then, do you know there's some people who could be allergic to aspirin? You're strong strange, yeah? Aspirin allergy is not so uncommon. It's something that, and then, Kamal is absolutely right. If you start taking a whole set of aspirin, you know what the aspirins could do? The aspirin could eat away the lining of your stomach. Now, having said that, aspirin is actually a great drug, right? A great tablet. And what I'm talking about is a baby aspirin. It's only 81 milligrams. It's not the regular. The regular aspirin you would get from a pharmacy for pain is 300 and something milligrams of aspirin. But a baby aspirin is only 81 milligrams. And what that does, the small dose of aspirin, small amount, thins your blood, makes your blood less sticky. It makes your blood less, your red blood cells and your platelets less sticky. That's important. Whereas ordinary aspirin that you might get from a drugstore or a pharmacy or so, that won't have the same effect of making your blood less sticky. It's a small baby aspirin that would have the effect. That sounds strange, right? That these low dose aspirin in a very low dose tends to thin your blood nicely. Whereas aspirin at a higher dose is a pain reliever. And then we have even bigger doses of aspirin that can be used for other purposes. You know, some people may be allergic to aspirin, and some people, even the baby aspirin, and especially bigger dose of aspirin, could kind of bruise the lining of the stomach, you know, and make the stomach bleed, make it raw, like red meat. You understand? And you don't really want that. Cause what we call a gastritis, right? But in general, we have ways of dealing with this, and you never do these things until you have checked with your doctor for the right sort of advice. You know, we have other medication, right? You know, there are medications that could help to reduce your cholesterol. If your cholesterol, that's one of the things that's helping to block up your blood vessels. And then there's high blood pressure tension, all these things are contributing. So the thinning of your blood, slowing of your heart rate, the reducing of your blood pressure, the reducing of your cholesterol, all these things will help to prevent strokes and so. But ultimately, you know, being close to somewhere, and that's why I'm saying, boy, I tell you, we get a hospital there. Imagine having to travel to Miami and New York. You have contacts up there and so forth, Kamal? Yeah, so if you're sick, you could go up there and you have the money to pay and all that kind of thing.
The money would be probably the issue for most people than anything else. But nutmeg.
Yes.
I think I've heard about using some nutmeg under your tongue or something, like if you're having a stroke.
Interesting.
I don't know.
Yes.
You're the doctor.
Yeah.
I don't know if you've ever come across that. If
there's
any home remedy that one can start to use before they even get to the...
Okay. Folks, let me tell you something about remedies. There were remedies that were used 2,000 years ago, around the time of Christ. Remedies that were used 1,000 years ago.
Okay.
Remedies that were used in this country or that country, and another country used different remedies. We've now entered into a modern era, and there is a need, we want more guarantees that whatever is tried will work. There's been some good new medications that have come out, but guess what? We found out that they don't work, or that they cause more side effects than anything else. You know, there was a great pain medication. When I practiced in America, I used to prescribe it all the time. It was so effective. And then I found out that this pain medication actually causes more heart attacks than relieving pain. I was shocked. I didn't have any patients who had any heart attacks. But the articles and studies show that a lot of other people in other parts of the country, the United States, were having heart attacks because of these things. One has to be very careful. So on one hand, we don't want to just try something. We want to know that something does work. I've not heard of the nutmeg situation. I'll check it out, right? One thing for sure, persons who have been taking aspirin definitely have seen a reduction and help, in that regard. There are various other I don't want to go through all the different medication that a patient might be on that would help them through those few minutes of a heart attack, that gets them through those few minutes until the ambulance come. When the ambulance come, the ambulance will put up a drip, some life water, and so that's just to make sure that they have an access that when they give you any other injection, it's going to go straight into your veins and your blood. You don't want just to take a tablet and then swallow it and go down your stomach and hope that it's going to get into your system. Maybe too slow, The ambulance will come and give you some oxygen because, remember, you'll be a little short of breath. They will relax you. There'll be a number of other things that they'll be able to do. But the most important thing is that we tend to draw blood, do tests, make sure what we're doing is right. So I'm not going to go into details of what happens in an emergency room during the time somebody's having a heart attack or someone's having a stroke. Those are two different. Every patient is slightly different to some degree. But because there's so many people having heart attacks and strokes, then a lot of people are similar. You understand? But one patient who comes in, it may be different from another patient who comes in an hour later. That's the point I'm making. Someone who comes in with a heart attack may come and say, but I have a tightness in my chest. And so. And what they're having is something of a mild heart attack. Whereas somebody comes in and they are already unconscious. The heart is not functioning. The heart muscle is so damaged that it's not pumping. And blood is not getting up to the brain. So therefore, the person goes unconscious. The brain needs blood, brain needs oxygen, brain needs nutrients. And that person is really in serious problems. And the doctors and nurses have to work hard with that patient to pull that patient back from the brink, And they're usually able to do it. They're able to do things to take over from the heart. They're able to do things to take over from the heart. When a patient goes unconscious, they're probably not going to be breathing. So we tend to put a tube down into someone's lungs, help them breathe. We would tend to start giving them some special medication to see if the heart, whatever is left of the heart muscle, to pump again, to get the blood circulating, because you don't want the blood to clot. You don't want the blood to stop flowing. That's not nice. Oh gosh, that's not, you want to keep it going. So I want you to understand that I've been talking about these later, but hear me. A stitch in time can save 9. What could be done much earlier? What could be done much earlier to avoid the heart attack or the stroke? You know what I'm saying, Kamal? What could one do? Do you wait until you have had the heart attack and the stroke? Do you wait until they've built? No, you want to, why is it building that? You want to start now. You know what I mean? Stop that smoking, man. Let's not have that unhealthy alcohol use. You have a beer, you know what I mean? A nice beer. One beer. Not a case of beer. You know what I'm saying? And rum is a culture, but why we have to finish the bottle? Is there correct?
We don't have much time, but we do have a question here.
Yes.
Kind of read it. It's like one of those, which came first, the egg or the chicken?
What was the question? What is the main function in your body? What's the main function in your body? Is it the heart or the kidney? What is the main organ of your body? Well, I tell you something. The main organ of your body is your brain. The main organ of your body is the brain. I would say afterwards say your heart. You know, kidneys could fail, and we can replace the kidney and we can put you on dialysis. There are people who really don't have no kidney function, and we can put you on dialysis. It's not nice. You know, it's inconvenient, but we have great dialysis facilities here, Georgetown, Kingston, Beachmount, and so forth. Long ago, people used to die from kidney problems. Oh, you know, kidney failure, they're all right. You know what I mean? You're right. So now the heart, we could also do a heart transplant, and we could do things to beef up the heart, even though a heart is just functioning 25%, 30%. The things we can do to tune up the heart, tune up the engine, tune up the heart is the engine, you know? But boy, I tell you something. So far, we have not been able to transplant the brain. You know what I mean? So the answer to your question is that none of the above, which is the main functional. I told you of the organ in the body. I would say none of the above. It is the brain. Right? Then comes the heart, you know? Right? Other people say other things, you know what I mean?
Well, hence the reason why I say it's like one of the you know, they have this question, which came first, the egg or the chicken.
Yes.
In this case, you just can't live without one or the other, because you can't
No,
live without the brain,
it's been something that's been debated many times,
Yeah,
and it's no longer debated. The brain, matter of fact, there's the brain is often, even though this part, the heartbeat is automatic, the brain helps to control the heart. If you get anxious, you know, your heartbeat start to beat faster, right? And the people could slow down their heart. Athletes could slow down their heart rates and so forth. Brain is so critical, you know, that your body can't function really without it. But your heart could have stopped, could have visited. We could still keep you going. We could still keep your blood circulated. We can put in an artificial heart, an iron heart, all them kind of things and so forth, and get things bumped. Your lungs, we could put you on a respirator and let that breathe for you until your lungs recover. A lot of people's lungs fail, you know, there are problems and so, right? We get into a stage of technology that we never had before, right? And it's challenging because things could still go wrong with the technology. You know what I mean? But you know, imagine Sivis, we now have an MRI, and we have CAT scans, and we have other devices that, when I first graduated as a medical doctor, some of those things we didn't have. You know, CAT scans were invented in the early 70s, MRIs in the late 80s, you know? And we now have sophisticated tests. In the 80s, we were still thinking cholesterol was just this and that. Now we are able to do some more sophisticated tests, and it's important we can now do it right and get it right. And I'm glad there are parts of the world, folks, where they don't have a medical facility for 100 miles. I have had an opportunity to travel to Africa on several occasions and go to some remote parts of Africa where they've got some strange diseases. And you become acutely conscious that if something were to go wrong, you yourself are under threat, and you reminisce that you lived so close to a hospital. Anyway, we've come to the end of the program. Ladies and gentlemen, it's been nice talking to you. Nice chatting with you. Do have a healthy good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at